All right. I'm gonna hit the slideshow button and then we'll get the show on the road. Dr. Sofia Ghani, or as I like to call you, Sophie Vaji, thank you so much for joining me this morning and accepting my invitation to talk about control over our health. And I like this title that you suggested, Where the Health Are You? Um, so before we get into it, let me go ahead and introduce you. Dr. Sofia Ghani is a or a pharmacist from the University of Texas, and she had a career as a pharmacist. And I'll let her get into her own journey a bit more in our conversation today. But there was a point in her life where she saw the overemphasis of pharmaceutical drugs, and today she's a health, wellness, and life coach where she works with all sorts of people, finding out where they are in their health, empowering them with knowledge, and then being their number one advocate in helping them to reach their overall goal. In fact, many of you have heard about this angel that comes into my life about during my recovery journey, and this nutritionist who gave me a nutrition plan and who gave me guidance on exercise and who gave me guidance in mindfulness and community and told me to prioritize sleep. And then after all of it, this person recommended that I write a book and I start something like BP Harmony. And that person was Dr. Sofia Ghani. So she is not only, um, someone that's near to me because of our family relationship, but also she was my number one advocate and someone who has real empathy for someone like myself who was in a place of imbalance, of illness. And I thought I was a pretty healthy person and I knew about health, but there's just so much that I got from working with Sophie, and we're gonna get into it. So that's your introduction, Sophie. I'll let you go ahead and say some introductory words, and we'll dive into some of the questions that we have for today.
Oh, thank you so much, Imran, for having me here. I'm so excited when you told me about this. And I was like, of course, this is, especially you being one of my favorite cousins. And yes, what you're doing, what you're trying to promote and help others. So this is my passion, and this is what I want to help others too. So it was a no-brainer for me to be here today. So excited for this session that we have together.
Awesome. Yeah, this can turn into a 20-minute conversation. It could turn into a 2-hour conversation. A lot of these conversations end up being, their structure, but then there's also, a bit of organic conversation that happen. And I'm still figuring out all of the ways to present these online conversations. And so this is the first time I have a slideshow going, so that it's just not two talking heads on the screen, but the audience can see the questions that are being discussed. So let's dive into it, yeah?
Do it.
All right, so this was something that you suggested we talk about. You know so much about gut health, you know so much about exercise, especially this place of strength training. You really introduced me to how it's beneficial for health because I ran cross country all my life and I love endurance sports like tennis. Um, but you wanted to start off with this question and more kind of taking a step back. And you starts with the premise of what you see in your field of health, wellness, life coaching, that not only do we not know what health is, what good health is, but there seems to be a feeling that we have little control over our own health. And I can testify to that amongst people who feel like no matter what they do, they will get high cholesterol, they will get high blood pressure. they will get heart disease, they will get sugar, and it's just a fact of life. And it's like, well, there's nothing I can do about it. And so I was thinking about this question, and I was like, I see what you're saying, but why don't let me just ask you the question, why does it feel like we have little to no control over our own health?
Yeah, and I think that's a good place to start because a lot of times, when we think about our health, the first thing that comes up is like, oh, I have to go to the doctor, and then we're going to go to the doctor. And historically, doctors have been obviously the primary source of our health information when we go to them, even for regular physical or when we have to go because we are sick. We obviously rely on their diagnosis. From what they ask us, the questions that we present to them. However, I feel that we put so much, I would say, trust into the diagnosis that they're giving us that we need to just be take a step back and also trust ourselves. Trust ourselves on how we are feeling about our health. By what I mean by that is, when we go to the doctor, an average time spent these days with the doctor is 10 to 20 minutes total. And the conversation that happens in those 10 to 20 minutes is basically the doctor trying to figure out what's going on. And they're asking the questions to the patient, and we are then answering to the doctor. And within that, do you feel within 10 to 20 minutes the doctor can get an idea of what is going on with your whole body?
I mean, there's an assumption that they're experts and that they will be able to. That's at least the trust that would go in with.
Right, right. And that's true, right? They're trying to diagnose, they're trying to figure out what's going on. But at the same time, we can do so much for our health. We know our history. We know how we've come to the point we've come to at the time of that visit. Whereas the doctor is getting a 10-minute briefing from us. And so the point that I'm trying to make is that we should, yes, we trust our doctor, but at the same time, we also need to be open to curiosity, to
Yeah.
question what is being said to us, especially if medication is involved, and maybe even get a second opinion. And so we need to take control, and we can take control by asking those questions and doing our own research.
Mm, okay. Um, this is a recurring theme in the conversations that I've had already with some of the folks. I've had an integrative medicine physician, I've had a therapist, and there is this sentiment, even amongst health professionals who are more holistic, who are more integrative, that not enough time in conventional medicine is taken to evaluate the our history, our I mean, there's going to be some evaluation or some survey that you fill out with regard to current medications, allergies, existing health conditions, previous health conditions, surgeries. But there's things like labs, things like psych evaluations, longer conversations, which these disciplines that I've mentioned of integrative medicine and even therapy or counseling take hours before even thinking about making a diagnosis. So my question back to you is, um, like, is it sufficient time, the 10 to 20 minutes to get an accurate diagnosis?
That's a very good question, and I don't know if it's a straightforward yes or no question or
Yeah,
answer to that because I feel like that's the starting point of the
yeah,
conversation that you're having with your physician and you're establishing a relationship with them. And, you know, but going into that conversation with your physician, I would say it's so much more beneficial if you go in with the mindset of let me enrich my physician with the information I can give to them
yeah,
before going to that appointment, before going there and just answering questions that are being asked.
yeah. Yeah, and I suppose some things that are straightforward, they can be addressed fairly quickly. You come to the doctor's office with poison ivy, it's pretty obvious what it is. Um, but in my own experience, coming in with mental illness and very quickly being given the diagnosis of bipolar disorder, I was just like, how did this person come up with such a serious diagnosis? And do they not realize like how big of a diagnosis that is, that how it changed my perception of myself, the serious side effects of the medication that were being prescribed without any for knowledge or even being told about the awful side effects. So I suppose though that I only went with it because I myself didn't have the knowledge. And what you're saying about providing physicians with as much knowledge about yourself is what will help the physician um, get to the right diagnosis. Um, a lot of people just don't even know what knowledge to present. And I suppose this could, segue us into the second question, which is, what are some practical first steps in gaining control of our health, um, especially when it comes to working with a physician? There's many ways you can answer this question, but maybe a good segue is this knowledge or information that you're talking about.
Yes, and what you mentioned when you were talking about this, that some things are straightforward. Yeah, poison ivy. Yeah, poison ivy. So more of the acute situations are more straightforward, but it's this growing burden of chronic disease and long-term illnesses, which might take a little bit longer to understand and maintain or have a whole plan as to how to go about this, right? And if we also express to our doctor, like, I would really like to look at my options and really incorporate lifestyle changes that like the person can make before stepping into going into medications, right? Because that's one of the things that, like you said, lab work might be done. Certain lab tests are not in the right reference range. And then it's like, okay, well, we're going to start you on this medication. But sometimes we don't even know what it is. But because the doctor is saying we need to do it, we do it.
Yeah.
And so creating that awareness, understanding the disease state, understanding ourselves. And so I think a very good first step would be to gather all the information you can in order to see what's going on with you. And that first step would be going to the doctor, getting that physical examination done. And based on your age, based on whatever past medical history that they look at prior to going into that physical exam, they will then be able to give you the information, and also they'll probably have some lab tests that they're going to order. And
Hmm.
so really looking at the lab tests that they're going to order and where are you in those in the ranges of those. And so certain lab tests that are done are standard, that are done on the physical exam. However, there are other lab tests that can be added to the traditional ones that can give us a little bit more information about our bodies and can help us then take care of it correctly in the right way based on those values that we get back. So I would say that would
What,
be a good first step.
okay, so a good first step is ordering your labs, and that could be a blood test, it could be urine sample, it could even be stool sample. I'm not
Mhm.
sure if doctors are doing stool samples. I know that there are other organizations that do that to assess things like gut health. But
Mhm.
you mentioned for bloods for labs that there are some traditional markers that come with a every blood test, and then some more niche ones that you can ask your doctor if they're not um,
Mhm.
doing it. So can you tell us a little bit about these foundational labs that everyone should get, and also how to read them, or maybe some tips on on the questions to ask a doctor about. First, let's talk about the foundational lab results that we want
Yeah.
to become familiar with.
Yeah. So the foundational ones are usually going to be the ones that the doctor are going to order regardless of, like a basic metabolic panel. And most of the time, they will do a lipid panel based on medical history and, your age. And so that will be ordered. Uh, so
I
you'll
think
get these.
lipid panel is referring to cholesterol and metabolic panel. I'm not sure what that is.
It's more your electrolytes, your sodium, potassium, chloride, and also your glucose.
Okay.
So yeah, so that one is that, and you're right. Lipid panel is the traditional total cholesterol, HDL, LDL, triglycerides. So that's what's included in there. And, there are some advanced lipid testing that can be added to that lipid panel, which is not done regularly, but that is something that can be asked if your doctor can go ahead and add that to it. A lot of times, what happens is that, it won't be approved because a certain milestone isn't reached in your decline of your health or some reason. So that test can't be ordered. But it's always a good idea to just ask. And the three lab tests that I tell my clients to ask their doctor is the hemoglobin A1C,
Okay.
which is a long-term control to see how well your sugar is controlled in your body. And so
Okay.
that's something that's usually it's added if there's a history of diabetes in your family, and also, certain, obviously, the conversation that you're having with your doctor. But if that's something that you can order, I would highly recommend that, just because the incidence of diabetes and prediabetes in our country has gone up and it's not going down. It's continuing to climb up. And so that's something I recommend my clients to order, and also a fasting insulin. So that's taking it a step further, ordering that to see how is your
What is
insulin,
it? What is it called?
the fasting insulin.
That's a test.
That's a test you can order, yes.
Fasting insulin. Okay.
Yeah. And those
So the
two,
you said you called the hemoglobin A1C and the
mhm,
fasting insulin. Okay.
yeah. And so that's those two tests are going to help you get a better idea of how good is your glucose control in your body, which is very important because that is one of the, I would say, it be, if we know what that is, we can control metabolic disease, the
Mm.
progression of metabolic disease that's going on in our bodies. So that's one of the good ones to order. And another one is your vitamin D levels. About
Oh, okay.
80%, yeah, about 80% of Americans are low in vitamin D. And a lot of physicians are starting to add that on their regular physical, but it's always a good idea to double check.
Yeah. Yeah,
Yeah.
no, our integrative medicine physician, she talks about vitamin D a lot. And she talks about sunlight exposure. She talks about magnesium a lot in order to be, uh, I guess my understanding is that in order for vitamin D to be synthesized by, sunlight to be synthesized into vitamin D, that there are certain preconditions like
Mhm.
magnesium in the body for the vitamin D to be converted. Um, so I'm glad to see consistency, from really the physicians that I'm talking to from a wellness who come with a wellness background and a holistic background, that these are similar labs that you are all looking at from various
Mhm.
approaches to holistic health.
Mhm. Yeah, yeah. Yeah, and like you said, right? It's important to look at it holistically, because in conventional medicine, we usually compartmentalize all the different disease states, right? If it's a heart condition, you go to the cardiologist. If it's lung, pulmonologist. If it's hormones, endocrinologist. But we need to look at all these systems together, because we're operating together with all these
Yeah.
systems. And so yeah, definitely a holistic approach. And I love functional medicine and integrative medicine because we're looking at the root cause. We're not
Mm.
just looking at the symptom. based on the symptoms that the patient is coming in with, okay, we're going to put you on this. But why is that
Yeah.
symptom happening? So
Yeah.
there are so many reasons that symptom can be going on, right? Like showing up.
Yeah. You mentioned about the conventional medicine being very much in silos. Certainly the consumer or the patient like ourselves feels that in the West when we go to the doctor for chest pain and they'll then refer us to a cardiologist. The cardiologist can't figure it out. They'll send us to the lungs specialist. The lung specialist can't figure it out. Then they might, I don't know where they might send us, but it seems like things are very much in silos. And I wanted to tangent a little bit or go dig deeper into gaining control of our health is understanding the use of pharmaceuticals in this typical approach to health. And um, I guess one of the things that's surprising to me is just the side effects of medication. It's not really I mean, that's a very soft word to call it a side effect, like, oh, you're going to get dizzy. But some of these medications, the side effects are things like permanent damage to the liver, and then you have to take another medication for it. I mean, I'll give an example from what I understand how certain cholesterol medicine work is that it is going to move that cholesterol from the blood into another organ like the liver, and then that causes fatty liver disease. And then, so a little bit of the anxiety I feel, and a lot of us feel in not having control of our own health is, well, once I do get high cholesterol, I'm going to be tied to these pills and it's going to curtail the quality of my life because I know that there are side effects so again, how do we liberate ourselves and the people listening to this? Um, and we're going to get into food, we're going to get into mindfulness, but before that, can you talk a little bit about the emphasis on pharmaceuticals, specifically from your own background as a pharmacist?
Mm-hmm. Yeah, I mean,
I know that was a lot.
our, yeah, well, I try to see how to say this in the most concise manner. Um, our healthcare system is management of a disease state, right? So it's basically we are taking a look at the patient, evaluating what's going on, and then they are prescribed a certain medication. Say, for example, like you mentioned, cholesterol medication. Okay, your total cholesterol and your LDL and whatever components are high, so we're going to put you on, say, for example, a statin or one of the more common cholesterol medications, and or they might say, we're going to put you in a statin in 3 months if you come back and your cholesterol hasn't gone down, but for now you can do lifestyle and make lifestyle changes, exercise more, and eat healthier. So that is the sort of prescription that's given. And then the patient will go home and they might try to clean their diet based on what they know is a good clean diet and exercise and do that for a couple of weeks, 1 or 2, 3 weeks. Maybe they're super motivated, but then that motivation goes down. They go back to their old patterns. And then
Yeah,
in 3 months, go back to the doctor. And then it's
yeah,
like, oh, medication, your cholesterol hasn't gone down. We're going to put you on a low dose statin, and then they get on this low dose statin. So what happens at this point is, and this is what I witnessed when I used to work in the cholesterol clinic way back when I worked at Baylor, is that people start relying on medication to do the job and really don't focus on where the long-term changes can happen and occur, which is lifestyle. Right? So we need to start placing more emphasis on changes that you need to make to your body, the way you think, the way you move, the way you eat. And so that to me is where I like to put the emphasis and let people know you can make so much of a difference in your health and you can even come off medication.
Mm,
And right, as like you were saying, side effects, that's not, we will tell patients, right? Okay, you might get muscle cramps because of this medication, or X, Y, and Z, right? Nausea, vomiting, diarrhea. That was always in the books in pharmacy school. NVD, that's what it was called. And so it's like these are okay. This is going to happen with medication. But what are the implications? What is really going on in your gut that's causing that?
yeah.
So that's really scary to know that, okay, this is just normal to have NVD or, dry mouth or, loss of libido due to certain medications. But what is really happening to those systems in your body long
Yeah.
term?
Yeah.
So it is, I mean, something that you just have to create the awareness. And the first step is becoming aware of, wow, these things are important.
Hmm.
And, during COVID, I worked at CVS and it was just dispensing medications because I always worked in a hospital pharmacy. So when I went into retail and just seeing how much medication is given out every single day, and it's just like, nobody's questioning anything, and it's just like, just give me my medication, I'm going to take it and I'll be fine.
Yeah.
But it's just
Well,
really sad to see this cycle, which can change so much if we just take a little bit of time to take care of ourselves.
I guess let me turn that question to you and say, you were the pharmacist, you were the one prescribing, and you were the one that pe a lot of people just kind of place trust into the medicine system or the
Mm.
disease management system. I guess what do you know for as a pharmacist that led you to leave that world essentially and to now be a more holistic health and wellness life coach?
Wow, what a great question, Ron, because honestly, I was the pharmacist who, if anybody even in my family had a slight headache or it was in pain, take the Advil, take the Tylenol, I was that person. Oh, you're having the sniffles. Let me get you an antibiotic. Let's go to the doctor. And now I've completely changed
Mm.
um the way, I approach illness. And
Oh wow.
so I think that
Sounds like
shift
a story.
happened. Yeah,
I want to hear the story.
yeah, no, it's honestly,
Even for your audience members, for SG coaching, I think
mhm.
they would love to hear this story.
Yeah, it happened because I honestly in pharmacy school and I know in, medical school, we don't have a lot of classes on nutrition and, just how to take care of our health. And even if they are on nutrition, it's more the biochemistry of it and
Right.
not really the application to how to manage disease states with health. So that's stuff that I would say I learned by becoming aware of functional medicine, becoming aware of holistic wellness back in, I would say, around 2011. And it really made me just really just this huge question mark came in my head. We're like, what? This is nuts. Why have I ever never even thought of this before to where, our gut is being destroyed by antibiotics, I always thought like,
Yeah.
oh, we're taking care of all the bad bugs, but the good bugs are dying too.
Yeah, I was floored when you told me that. Um,
Yeah.
it's nuanced. Not all antibiotics for all situations are a bad thing, but for most things they can be avoided, provided the specific context.
Right, right. And it's just those epiphanies that happen on my journey to where the ways we can support our body and take care of ourselves, and really it's taking ownership of our health and becoming aware that we and knowing that we have so much power
Yeah,
over how we perform. Our bodies are created to heal and to get better. And yes, there is a place for medicine and medication for sure, but I don't think that should be first line therapy, or it should be something where we once get on it, just think that, oh, okay, we're going to be this on it for life. So, I'll just go about my ways and be good here and there.
Yeah.
Yeah.
Well, I guess you must have had to take some first steps yourself, leaving this whole world of pharmaceutical drugs. And I guess what was your journey in gaining a sense of your own health and maybe even unlearning certain things to be where you are right now.
Yeah, like you mentioned, right? It's I was one of those persons who would always reach for the Advil and just take the Advil if I had a headache
Right.
or medication. But I learned that, you know, I thought I was eating healthy, but I wasn't really eating healthy.
Mm,
And so I learned on the journey of how to eat and, just reading the medical literature, also listening to other functional medicine doctors and how they approach health and looking at the body holistically and getting to the root cause of disease. I that really what intrigued me the most is really figuring out what is causing what and how one system is linked to the other system. And if, for example, your adrenal system, your cortisol and your stress is high, how that affects your gut, how that affects your hormones. So learning how everything is connected and then creating this plan of how to take care of yourself.
mm,
So I don't know, that was just all very interesting. And then obviously working with clients and getting them into better health and seeing how their health shifted for the better. That's that to me was just the best thing.
yeah. Um, or I know you like to read, I like to read, and I would like you encourage me, I would encourage you to write a book someday, and I'd be happy to edit and help with the drafts. But in this hypothetical book that, I hope you write one day, what are maybe the top 3 or 5 resources that you would reference um, in the book that you write? And I ask this so that people can find these books for themselves or certain thought leaders online to gain a sense of control over their health.
Yeah, yeah, that's a good question.
I mean, in
Well,
the
I
future,
mean,
there will be Dr. Sofia Ghani's book that everyone can get. But in the meantime, what,
oh well, thank you for seeding that in my head, Imran. And one day, yes, why not? But yeah, in terms of the physicians that I followed for years, and the number one, Dr. Mark Hyman, who was my very first, I would say, who I started listening to, and that's where my curiosity started about functional medicine. So he would be one of the good resources that one can go to get information. There's another doctor, Dr. Peter Attia, and I like his style. I like how he talks about health and really emphasizes exercise. And of course, I also advocate for strength training, resistance training, and I think that's a huge, huge area that one can get into and get into better health. So him, who else? I would say. I actually have a book that I'm reading right now, Dr. Jolene Brighton, right over here. And this is Beyond the Pill. This is for women are placed on birth control pills. And these days, I'm very interested in women's hormones and
yeah.
perimenopause, menopause, and PCOS. And so that's one of the books that I'm reading. So those are some of the ones that, there's also Dr. Robert Lustig, and he's written a book called Metabolical. And I think
Hmm.
that would be a great book to read as well. And it kind of talks about uh, the health industry, the food industry, and big pharma. So it's an interesting read.
Oh, yes, the stuff I like to get into about the current events and history and how, since World War II, a lot of things that should be in one industry are now in the food industry. Uh,
Mhm.
so okay. Well, I would love to see a book from you, Dr. Sophia. I think it helped me especially with BP Harmony, and it just became my guiding compass for everything that I do at the with BP Harmony now. It's just sleep, nutrition, movement, mindfulness, community. It's just over and over again. But the base of all of that, it's all of it is knowledge. So I'm sort of a broker of knowledge, and that's why I said, you know what, my knowledge has run out in terms of what I can provide. Let me find the experts who I benefited from, and start bringing them in to create content together.
Beautiful.
So let's segue over to food and its role in health. This is perhaps it flows from the first question of, why does it feel like we don't have control, and what are some practical steps? And a lot of people know from the doctor's advice that they should be eating healthier. But I think even when I started working with you, I did not know. I thought I knew what eating healthy was until I understood from you that eating healthy isn't just salad. Um, it's it's so much more. It's about a well-balanced diet, and also the elimination of certain ingredients that are prevalent especially in the Western modern diet. In fact, before I started working for it with you, there was a time where I was eating a bowl of walnuts and like drenched in like this coconut drink, which was so awful. And like I have a pretty high tolerance for quote unquote healthy food that doesn't taste good. But even that moment, I was just like, what am I doing? Like I this is and then I learned that like healthy food, a well-balanced diet can actually taste really good too. So with that preface, let's dive into the wonderful world of food and its role in gaining a sense of control in our health.
Yes, yes. So I think this is one of the fastest ways you can make a change in how you feel and in your health, because we eat more than once a day, right? Most of us. We
Hmm.
eat 3 to 4, maybe even 5 times a day, depending on who it is or how long they're staying awake. And so every time we eat, we are providing information to our body. And so it's so important to then start thinking about, okay, how can I take care of myself? And obviously, everybody's going to have a different starting point, but maybe one of the first things you can do, always go for the lowest hanging fruit. Go for the thing that's easiest for you. So, for
Yeah.
example, if someone eats out 5 times a week, say they eat out at least one lunch or one dinner a day, that's food that you are not cooking, and we don't know what the ingredients are, how it's being cooked, what oils are being used, the quality of the food. And so maybe just taking an audit of how many times are you eating outside? And if it's 5 or 4 times, can you just go down to half of it,
Hmm.
right? Just take baby steps, small steps. And then once you do that, okay, you're taking care of that part. And then another thing you can also look into is, how much processed food am I having or is in my house?
Yeah.
And that's also one of the major causes of chronic disease, of diabetes, is because of all the processed food. And now it's not just called processed, it's called ultra processed food because it's worse than processed food. And so how and the way you can kind of think about it and see if you are having it, what are you eating that's coming in a box or in a package and
Mm.
has ingredients, ingredients list where you are reading things that don't even you can't even pronounce.
Yeah.
So that's something where you can take a look at and then start cleaning up your house, right? Detoxing the house, getting the things that are not good for you to eat from the house. And once you do that, even if you do it for a couple of things, right? You're doing something, you're working towards it.
Hmm.
So you should also, acknowledge that, yes, I'm getting better. I'm doing better. And so I think you can start from there. And then another easy swap can be what kind of oils are you using to cook? Is it
Uh-huh.
vegetable oil? Is it canola oil? Those are the inflammatory oils. Let's take those out of our house, out of our condiments that we're using. Check the condiments. A lot of salad dressings have those ingredients in it. Or even if you're having once again processed food, look at the labels. Does it have sunflower oil or sunflower seed oil or grapeseed oil? Any vegetable oil. Just try to buy the cleaner versions.
Which
And
are?
so, yeah, that could be an easy swap as well. So I would say that. And then now that you've
What are those swaps for oils?
for oils, it would be extra virgin olive oil, can do avocado oil. Coconut oil is good too. I prefer to stick with the extra virgin olive oil or the avocado oil.
Yeah.
Um, so yeah, those are some things that you can take out. And so now question.
I know you're more plant-based, but I've started getting into tallow and butter and um uh, I have been finding really, really good results with those as well with regard to like my skin. And then even my cholesterol levels, because of my genetics, they are on the high side, but it hasn't been impacted in a significant way.
Mm-hmm. No, those are good because it's pure, right? It's
Yeah.
it's it's a pure source. So yes, those are good, like ghee.
Mhm.
Um, so those are, but at the same time, then you have to see also, where's the person starting off,
Right, that's true.
and yeah, where are they in their body as far as their metabolic health.
Yeah.
And so that can change that a little bit as to what you should use out of those. Um, But as you clean your house of those things, what can you add? So something that you can add into your life is, start taking a look at how much water you're drinking.
Hmm.
Hydration, super important. And
Yeah, that
yeah,
was a big one when was working with you.
mhm. How's it now? You doing good with it?
Oh, to this day, I'm drinking over 100 ounces to a gallon of water every single day, and
Wow.
it's changed my life for the better. It's work in the beginning, but
Mhm.
now it's kind of like I totally feel it when I don't drink sufficient water.
Yes,
Because
yes.
life is just so much better when you are hydrated. You just don't know. Like the thing is, people are mostly chronically dehydrated, and they're just like, "Oh, my back hurts, my muscles are sore, I'm sleepy." Like so much of it is tied to hydration.
Yeah, yeah, super important. So yeah, definitely, something to evaluate. And if you are on the end where, I know some people who only would have one glass of water a day. And
Yeah,
so when you go from that to increasing your hydration, you're going to feel the changes. And yeah, it'll be a little bit of work getting to a certain point, but it's definitely our bodies are made up of 70 to 80% water. So we need
yeah,
to hydrate. We need to provide that hydration to our bodies, our kidneys, everything to filtrate all the stuff out of our bodies too. So that is something that I usually ask as well. And how can we provide nutrients to our body? Like just flood it with nutrients. And I know this is one of the things that you had mentioned that it really stuck out to you when I had told you about the rainbow, right?
eating the rainbow. Yeah, yeah, yeah. Tell me more, or like, yeah,
Yeah,
let
so
the viewers know what that means.
yeah, so eating the colors of the rainbow. So every week, when you go to the grocery store, or if you're going to start going to the grocery store after hearing this episode, you know, get a variety of fruits and vegetables, all different colors, spectrum of the rainbow, and have one of the colors every day of the week. And within that week, that will provide your body with nutrients that you might not have gotten in a while. So if you do that, then you're doing your body good. So,
Yeah, and that's such a good, useful way because when we're told like, oh, you need this vitamin, this macronutrient, when you said eat the rainbow, I think what you were saying is eat a well-balanced, nutrient-dense diet because the greens are going to give you your vitamin K, your vitamin C, your reds are going to give you, I can't remember it, but I remember looking it up and being like, oh, like this is giving me the full range of, vitamins that I need in my diet.
Mhm.
Um, you said something earlier that caught my attention that I was wondering if you could give give me some more details about. You mentioned that every time we eat something, we give our body information. And that kept coming in my mind when you were talking about processed foods and inflammatory foods as well. So my question is, can you define processed foods? And then number two, can you define what is inflammation or inflammatory foods? And what is it the information uh what is this information that we're giving our body if we're eating processed or inflammatory foods, and what information are we giving our body when eating, nutrient dense whole foods?
Mm-hmm. So when we eat food, basically we are providing every cell of our body information. And that information is then going to go and cause our genes to be expressed in a certain way, right?
Okay.
Gene expression. And so based on that, now is the food that we're eating, is it helping us or is it not?
Mhm.
And of course, if we are eating foods that are inflammatory or that will cause insult to a certain area of our body, for example, let's take, say, for some people, gluten who are gluten sensitive. And so if somebody ingests something that is has gluten, a high content of gluten, and they are sensitive to that, that means that that gluten is then going to go into the gut. And when it goes into the gut lining is going to be affected by that gluten, and that gluten is gonna cause certain reactions to where it will then, I don't know if you've heard of leaky gut, but it
Oh
causes.
yeah, I had that.
Okay, yeah. So then basically what happens is that it's going to react with certain cells, and then it's going to cause those junctions of your gut lining to loosen. And then when they loosen, that then causes things that should not go from your gut into the bloodstream, right? Inside past that gut
Yeah,
lining. And so that's when the immune cells are right in front of the gut lining. And so when things that are not supposed to be coming in, the immune system gets alerted and it's like, oh, we have to like do something now. And so that's when the immune system starts spewing out things and then what happens is there's this inflammatory response that happens, right? And this is just an example that I'm giving you, right? And so now you have this inflammatory reaction where you you're having a leaky gut, which is causing inflammation and different things that
inflammation of what though? Like inflammation of blood vessels, of tissue, of nerves, of bone. I've always wondered what is getting inflamed.
so it depends what area is being insulted, right?
Uh-huh.
So because when a specific area can be targeted because of the inflammation of the vessels, like you said, right? That's what CVD is, right? Sorry, coronary artery disease.
Yeah.
So they're just different areas that can be inflamed. And that's why when we do the blood test that can give us an indication there's inflammation going on in the body,
Yeah.
we can by that lab value, we can tell there's inflammation going on, but it's not specific to where it's happening.
Yeah.
And so
I
then,
think you told me there's a specific blood test for testing inflammation.
yes, which is the CRP, the
CRP. Okay.
C-reactive protein. And so that one is, it tells you about inflammation going on in the body, but where is it happening? That's non-specific. But that's more of then you would have to go to your healthcare professional or to, your integrative
Yeah.
a doctor, and then they can do more research and do more specific lab tests, like you were saying, right? They check stool testing and they can see what's, what are the levels of the pathogenic bacteria um, that are in the stool or parasites or whatever they check for. And then based on those markers, you can then figure out where the inflammation is occurring.
Hmm.
Yeah.
Yeah, I mean, this is the nitty-gritty of what holistic practitioners talk about root cause. And from what I've learned is that inflammation is at the root of so many chronic health issues like blood pressure, cholesterol, diabetes, type 2, I think. But a
Yes.
lot of these chronic health issues that don't really have a cure yet, uh, it starts with some form of inflammation, and then it festers and turns into something that now has a name and a blood marker.
Right. Yep.
Yeah.
Yeah. So it's that insult that's happening. So every day, if you're eating some sort of food that's processed, and then that's every time, maybe if you're eating that food 2, 3 times a day, that constant, continuous insult is then causing inflammation, inflammation, inflammation. But sometimes these things don't show up till a certain point of inflammation
Hmm.
is going on in our bodies, right? And
Yeah.
so, I just recently read somewhere, Alzheimer's, when it shows up, it really started happening decades ago.
Mm.
It doesn't just show up when
Yeah.
it's, detected.
Yeah.
So insults happen, and that causes this slow inflammation, and so if we can take away the factors that cause it, then we're essentially, hopefully preventing these chronic illnesses, which the root cause is inflammation.
So I think in this section, we've talked about how food can be a source of inflammation and how, the information that we're giving to our body. There's just so much I gather from you every time we talk about food, and there's no way we're going to get to the bottom of it. But I think some of the salient things I've learned in this conversation is that number one, that a way to control of our health is to really purge our lives of processed foods, things that are in a box, things that have a long ingredient list, and to go to the meat, produce side of the grocery store and make it work with these things. Start really with an elimination approach, eating the rainbow from your organic fruits and vegetables and your pasture raised or wild caught meats. And then, we won't get into portion control and the macronutrients because the audience can get that from my book, where I talk about portion control. I talk about protein, fats, carbs, electrolytes, water. So those things we don't have to get into. And I think this is a bit of a teaser for our future conversation on the gut health because um, you know, previous guests have also mentioned that, the famous Hippocrates statement that all disease begins with the gut.
Mhm.
So much to say, but I think a good segue to our next point is you mentioned that food can be a source of inflammation. But then how about other things like our thoughts? And what is the role of our thinking, of our thought patterns? So let's talk about our thoughts and their role in health, and specifically because we talk about bipolar disorder, I talk at length about how food is huge at controlling mood, at healing gut health, which then helps the mind. And then this is really where I got from you the mindfulness piece for BP Harmony is that we can be eating all the right food, we can be doing all the exercise, but if the way we see ourselves is is really cancerous, then it's, and in many ways can won't do much for our overall well-being.
Right. Yes. So true, Ron. So true. And I think a lot of times, like when we think about our health, the first place we do go to is I got to eat better and I got to move. I got to exercise, right?
Yeah.
And and thinking about our thoughts or our mental health really is not something that we emphasize or think about. However, our thoughts are have a direct impact on our health and our reality, the way we think, what we think of. And it's very important for us to really start thinking um, about how we talk to ourselves and what thoughts are we having on a recurring basis. Because when we repeatedly think of certain thoughts, especially negative ones, not our brains, our brain releases chemicals. And and those chemicals that it releases create a specific emotional state, right? So we feel a certain way. We feel it in our body. We feel constriction or we feel some tightness. And so over time, these emotional states, they become a pattern, a habit of how we think, of how we perceive, how we talk to ourselves. And then that causes either stress in our life, anxiety can show up as illness. And so for us to really think about and observe ourselves and start observing our thoughts, becoming aware of our patterns,
Mm.
that causes certain uh, I don't like to use the word triggers, but it causes us to react a certain way is very
Yeah.
important because we all have
Habits or patterns.
experienced trauma in our life, right?
Yeah.
Big T, small t, we all have gone through trauma and our body holds this information. So we need to take the time to spend with ourselves to really get in touch with our emotional state and what causes us to feel a certain way. And only then can we break free and rewire our brains to to react to situations, to stay calm, and that mindfulness and the practices that we can start practicing breath work, which I know you do a lot of. And so it's very, very important for us to really look at our habits or behaviors, how we're thinking, and to reprogram that subconscious repetitive thoughts. And the only way we can do that is to become aware of those subconscious thoughts, bring it out into the awareness, and
Mm.
then continuously on a regular basis practice that meditation, that work that we need to do to help
Mm.
us.
Mm. Yep, 1000%. I write in my book, and I've shared with you as well, is from the fall of 2019 to the fall of 2020, um, I was really focusing on the physical body by eating right, sleeping right, exercising right. But I would find myself having these intense mood swings and these strong feelings of anger, strong feelings of happiness, and not happiness, but more like euphoria or pleasure, which is a salient feature of being in the acute phases of bipolar disorder. And I started doing some yoga videos to help with the soreness of my body. And then I was like, I felt so good after doing the yoga sessions. I was like, oh, the chaos of my mind. Well, first of all, I even noticed that there was chaos in my mind. And, so like you said, there's I think it was a you who's told me, or I've heard it, is that uh, the source of disease is dis-ease. And I don't know if you've ever heard of that, but
Mhm.
it's a good one.
Yes, it's a good one.
Uh, any
So
practical tips that you have for um, observing your thoughts? Because it can seem a little bit like, well, how do I do it? Any
yeah,
first steps on how to go about doing that?
yeah, I'll tell you mine, but I'm very curious to hear your how you
Yeah.
do it too. I would say based on, my journey, and I've had to change the way I talk to myself too.
Mm.
And I feel not really putting that pressure on yourself, like, oh my gosh, I gotta like really observe myself and see what's going on, but just opening up that space, having that conversation with yourself where you're just inviting yourself to be like, it's okay where you are, and fully accepting and with compassion, really, where you are, and holding that space for yourself like we hold for others. And just telling yourself, okay, today set an intention that I want to really observe how I am with myself, and how do I talk to myself?
Mm-hmm.
What am I thinking? And
Mm-hmm.
when this negative thought comes, how is my body reacting? In what situations do I close down? Or when do I just get hyper, like, or whatever you're feeling?
Yeah.
Really, really observe yourself. And the more you start doing it, the the more often you will be able to observe yourself, and the more you will be able to understand how you react to that, because everything we experience is because of past experience, right? The beliefs that we have. And so it's really unpacking that, bringing it to the forefront, allowing us to see it face to face, and then really reconciling with that
Yeah.
and saying, before I used to react like this, but now I want to react like this, and then start practicing that.
Hmm. Yeah, I think it I to add to that, I would say before doing those things, you have to prepare the physical body to be able to do that. And so what I do at BP Harmony is first, there's a lot of congestion up here. The awareness of ourselves, of who we truly are, is very much associated with I, with the ego. And the attachment to this permanent sense of Imran, or the permanent sense of Sophia, Sophia becomes a source for that congestion. And that's where the world of Tasawwuf or Sufism and the world of yoga have taught me that a lot of our anxiety and depression has to do with the fact that we are not in the present moment. And it sounds cliche, but if you think about all of the things that stress us out, it's either about something that happened earlier today or yesterday, last week, last month, last year, and we're still ruminating about the things that make us unhappy. And then we're thinking about the infinite imaginations about the future. Oh, what if this happens? What if that happens? So both the Sufis and the yogis, I find them saying that the path to felicity, or the path to really ending this kind of suffering, is to be anchored in the present moment. In fact, the Sufis say that the Sufi is the one who is Ibnul Waqt, the child of the moment, which means that they are just very present in the moment. And I was able to find teachers in the yoga world because it's not as accessible in the Muslim world today. And I found it that it's very accessible through yoga of how to find ourselves in the present moment. First, bringing the awareness, distributing it throughout the body by bringing our awareness to the breath, noticing taking deep breaths. We know all of the scientific benefits of deep breathing, breathing with our bellies and our diaphragms, and allowing there to be rich oxygen through our blood. But even just noticing the mundane details of the quality of the air helps us to stop thinking about the past and the future, and just noticing mundane details about, oh, is the air hot or cold, dry or moist? Is there a smell? And simply focusing on the inhale and the exhale. It might seem mundane, but you try to do it. If you've never done it for like 3 minutes, you'll find yourself thinking still about, oh, what do I need to do afterwards, or what do I do before? So at first it's about quieting the mind, then it's about distributing awareness throughout the body by moving the body a bit, and feeling the heat in our core, in our muscles. And that when we realize that when we are kind of really present with the burn, as they say, then we're not thinking about our worries. And that's why a lot of people do work out, because it silences the chaos of the mind. And
Mm.
then lastly are more practical techniques like part speech, where we disassociate ourselves from our ego. And if, let's say, for example, we say that I am stressed out right now because of um, my work. Instead of saying I am stressed out, we'll say my body is feeling disturbance. And then we'll go into further degrees by removing the my and say something like this body is feeling temporary agitation or, imbalance. And that separates a sense of permanence. It separates a sense of this is who I am, a stressed out person. And there's levels of detachment happening and separating who we are truly, and that these ephemeral feelings and side effects on the physical body are not who we truly are.
Mm.
So I parse all of these things out in the book, and then as well as in my, the yoga sessions that I don't know if you know, but I've launched a community and now I'm doing live yoga classes online. Um, Tuesday, Wednesday, Thursday, and Saturdays you know, starting next Tuesday.
Oh,
Uh,
wow.
so
Awesome.
yeah, I'm excited to start getting a little bit more flexible because I've been lifting a lot and lost a bit of flexibility. But really excited to be meditating more and spending time in quieting the mind. And I've
Mhm.
realized that when I sit in silence for a solid hour or so, I'm so much more productive, having kind of tidied up the clutter of my mind.
Yeah. Yeah, that's so true. And that's so good that, you practice this and you're doing this. And I really feel like sometimes when I get really busy and I miss that time with myself to just sit and be still, I can tell the disturbance, I can tell the misalignment. And then I know that I have to go back and I have to just be one, just kind of just take my time and be still. So
Yeah,
that's super important. And what you were saying about, being in the present moment, and that's just so very important. And it's hard. It's hard to be in the present moment, but the more we do practice it, I feel it's, intention, uh, and always having an intention when you start something. What is my intention for doing this? What is my intention for today? And so I
yeah,
think for me that's huge, is like trying to just be intentional. And what is my purpose, what is my intention, and not staying in the past and going back to the past memories, but staying in the present, being conscious of being here, um because then that's setting the stage for the future. But if we're
yeah,
always in the past and with that anxiety and in that emotional state, then we're always going back and recreating that
yeah.
in our minds. So very, very good.
This point of presence that we're finishing on, and this idea of knowing ourselves, checking in on ourselves, to me goes back to your first point. And I put a question mark next to it when you stated that um, when we are looking to get gain a sense of control over our health, we have to be our number one advocate. We have to know ourselves. And I think we've kind of stumbled upon the way to do that, right? Because when you first told me, it's like, Imran, you got to know yourself and you got to know your. I was like, I don't know about myself. I don't know anything about health. I don't know what's wrong with me. I don't know. And then no, you were like, no, no, you have to number one, no, get the knowledge slowly, but really, like, it was your people like yourself, my mother, they would say you really have to know yourself. And so I think ending on this idea of presence, of taking time to spend time with ourselves, will be in service to so many things. One of the ones would be a sense of control over our own health. Because when we can control our own thoughts, then we can control the way that we look at the world, and the way we paint the world is going to have certain outcomes in our physical health.
Mhm. 100%. 100%. Yeah.
Uh,
Yeah.
well,
And
this is
no, I just wanted to say one thing. What I always tell my, clients and everyone is just have fun on this journey, right?
Mhm.
We're able to do it and enjoy every moment of being able to take care of yourself and not to see it as something that you have to do. And
Mm,
we're getting to do it and we have the ability to do it. So let's do it with this love
mm.
of taking care of oneself.
I appreciate that so much because even when I was in it and you would tell me stuff like that, I think you would say it when I would be so fixated on when will I get better? When will I get off of these medications? When will I stop feeling this way? And, I think now what I tell clients is, all of these loss of medication and it's going to be incidental to the overall quality of life and lifestyle habits that you will gain along the journey.
Yeah.
Any conclusion, any final remarks before we sign off for the day? Maybe talk to us a bit about your practice and what you've got in the works soon coming out.
Okay, yeah. Well, no, I had a great time. I love talking health and we just go into different, tangents and stuff. So it's been awesome and I'm so happy to see your growth and so proud of you and what you're doing and how you're helping people. So it just makes my heart so happy and that's what I'm doing right now and I do have I do one-on-one health coaching for individuals in the works. I do have some a community that's going to be coming out soon next year, and also a group coaching program. But yeah, so that's what's going on right now.
Amazing. Amazing. Well, Sophie Baji, thank you. Dr. Sofia Ghani, thank you for joining me in this first of many conversations at BP Harmony. And thank you again for everything that you've done for me and now for the BP Harmony community.
Oh, well, thank you for having me, little cousin.
You're welcome. You're welcome. Take care.
All right. Bye.